Good morning, everyone. We're going to give the webinar time to have folks log on and increase the participants. So we'll get started in just a few minutes. Thank you for your patience. Okay, looks like our participant levels have kind of evened off. So I think we'll go ahead and get started this morning. Good morning, everyone. My name is Charity Lumpkin, and I'm the Member Experience Manager with the Office of Medicaid. And we appreciate you joining today to learn about the Indiana Pathways for Aging program. Next slide. Today's agenda is what is Pathways for Aging? How am I affected? What do I need to do? And then there'll be a time for some question and answer and discussion. The discussion is not going to be open, but we'll be answering some frequently asked questions. Next slide. What is Pathways for Aging? Next slide. Pathways for Aging is a new program for Hoosiers 60 years of age and older and are on Medicaid. And that would be Medicaid for those that are aged, blind, and disabled. It's a program that starts July of 2024, and it does not affect Hoosiers' Medicare benefits. This is a Medicaid program. Next slide. Pathways for Aging is a health insurance plan. It's called managed care. We have managed care entities, or what we call MCEs, and those MCEs will be in charge of making sure that services get covered. So services such as doctor's visits, prescriptions, physical therapy, nursing home services if someone's in a nursing home, hospital coverage, x-rays, and if someone is on a waiver, waiver services are covered as well. The three MCEs that the state is contracted with are Anthem, Humana, and United Healthcare. Next slide. So why is the state making this change? That is the most frequent question that we get. So currently, the state of Indiana has found that most Hoosiers who go on Medicaid and are above 65 end up aging in a nursing home. And so this is about choice predominantly. Hoosiers want to age at home, and currently that's not where they're aging. And so the Pathways for Aging program is a program that's going to have choice for that. The next is cost. Hoosiers are getting older, and too many people are living in a nursing home, and living in the nursing home is very costly. The third is quality of care. Hoosiers deserve the best care, whether you're an infant or aged. We want to make sure that folks are getting the best care possible. And we feel that the Pathways for Aging is the best process in order to do that moving forward. Next slide. Pathways for Aging will provide members with lots of support. So currently our Medicaid program for this group does not do that. So the first level of support that folks have is our enrollment brokers. When folks call the Pathways for Aging number, they're going to reach out and get a hold of our enrollment broker individuals. Those individuals are someone that helps member choose a managed care entity. So when you call the Pathways for Aging number, you'll get a person on the other line, and they'll be able to talk with you and assisting in selecting that plan. The next is our care coordinator. So each MCE, managed care entity, Anthem, Humana, or United, we'll have a support member, we'll have a care coordinator for each of the PathWays members. And that care coordinator will support members' healthcare needs. So they'll know if someone misses a doctor's appointment or hasn't picked up a prescription. These are going to be folks that you all are going to get to know as members. And you'll be able to reach out and talk with them. They'll be able to reach out and talk with you. If you've missed a doctor's appointment, don't be surprised. They might give you a call to find out if the doctor's office has changed locations and you're having difficulty getting there, or if you're not happy with that provider. That's something that they'll reach out and assist with. Another thing is, if you've not picked up a prescription, they also might reach out to find out why you've not picked up that prescription. Is it too expensive? Do you now need to look at having prescriptions mailed? So the care coordinator is really a level of support that folks are going to have in order to help them navigate through their healthcare needs. The next level is service coordination. The service coordinator is there to help support folks with waiver needs. So that person will be assisting in navigating supports in the home and all those things that go along with the waiver. Assistance with navigating both Medicaid and Medicare benefits. Currently, our systems are kind of disjointed and don't talk a lot. So with the Pathways for Aging, we really are looking at supporting folks and making sure that all benefits, both Medicare and benefits, are working together for our members. And then member support service vendors, someone to call if a member or a caregiver has a concern or a complaint. So this will be a number that folks can call, one number, so they can call and direct those concerns or complaints and have those listened to and figured out and assisted with. Next slide. So how are you affected? Next slide. If you're currently on Medicaid and you're 60 years of age or older and receive Medicaid for the aged, the blind, or the disabled, you will have to pick a managed care entity to continue to get services. Letters from the state began going out February the 19th, and they continued through March the 22nd. And they tell folks how to pick a managed care entity. You may have gotten a phone call as well if you're on a waiver or in a nursing home. The state began calling a few weeks ago, and so those calls are going out to also remind folks that they need to pick an MCE and to assist with that. Next slide. You can still get all the services through the Pathways program that you're currently getting on Medicaid. This includes nursing home services and waiver services. Plus, your managed care entity might give you other benefits like improved vision and dental care, home safety kits, or support for family caregivers. When the notices went out, they included a pamphlet or another additional page that explained those additional benefits that each MCE has. And those are individualized based on the managed care entity. Those are not through the state. The managed care entity will never reach out to you directly until the plan goes live. So currently, all the information that's coming out about the Pathways for Aging program is coming directly from the state of Indiana. So letters and phone calls are coming directly from the state in regards to signing up for the Pathways program. Next slide. What do you need to do? Next slide. The deadline to pick a managed care entity or your MCE is April the 30th. So we're coming up pretty quickly. Today is April the 4th. So remember that there are 3 managed care entities to pick from: Anthem, Humana, and United. If you don't pick an MCE, the state will end up picking one for you. But all you have to do is call into our Pathways for Aging number and you'll get to pick your plan. Next slide. We really want you to make that choice and you to pick your plan. We don't want to have to pick that plan for you. We want you to have control of which MCE serves you. You can make sure that all your providers that are important to you can still give you services that you need, and those providers can be looked at when you call the Pathways for Aging program. Next slide. The phone number to call to get help picking your managed care entity or MCE is 877-284-9294. And a couple of things that you'll want to have handy is you should know your Medicaid ID number. When you call in, that's one thing that they request at the top of the call. You can also give them your Social Security number. They will also need a correct phone number and address, and make sure that your date of birth is correct. So if you've moved in the last few years, you might want to call the Division of Family Resources to double check that your address has been updated. You'll also want to know your primary medical provider, the doctor that you go to for your regular scheduled visits, and if you're on a waiver, what your waiver provider is. Next slide. Again, the phone number to call to help pick your MCE is 87 PathWays 4 or 877-284-9294. You would reach out to the Division of Family Resources if you need to check that your address and your phone number are correct. If you've not gotten your Pathways for Aging letter yet, as those have stopped going out, you will want to call the Division of Family Resources to ensure that they have your correct address. Also, if you'd like to go in and look at information, frequently asked questions, comparisons of the managed care entities, you're able to go to our website, www.in.gov/pathways, and on that website, there's wonderful tools that can help navigate, answer questions that you may not get answered on this webinar, go through and look at the different plans, the selection process. There's questions for providers, there's questions for members, and it's just a really great resource. Next slide. What you need to do to continued. If you change your mind and want to pick a different managed care entity, you can. So if you've previously called the Pathways number and selected a managed care entity, and you've decided today or tomorrow that you'd like to switch, anytime before July the 1st, you're able to switch your plan. Also, within 90 days of enrolling in the managed care entity. So enrollment starts July the 1st. So you're also able to change the selection before September the 30th of 2024, and then once again throughout the year for any reason. So we don't want folks to feel like if they call in today, they're locked into that MCE. You are able to make plan changes. Next slide. Next slide. So again, resources and FAQs, we discussed that a minute ago. The Indiana Pathways website is a wonderful tool. Calling the Pathways number is also a great tool. So the state has frequently asked questions at www.in.gov/pathways. It asks and answers things such as the program go live date, which is July, general program questions, eligibility information, which health plans we have, Anthem, Humana, and United, coverage benefits, Medicare, duals, and DSNPs. So those are all individualized things that come up frequently. And so we encourage folks to go to our website and take a look at that. This presentation in particular is designed strictly for members. So we are not going to be answering any provider-related questions, and we do encourage folks who have provider-related questions to send those to our back home Indiana mailbox. A couple of the frequently asked questions that we get are, does the Pathways program affect Medicare? And I'd like to just say again, Pathways does not affect Medicare. It is a Medicaid-only program. Individuals can have both Medicare and Medicaid, but the Pathways for Aging program is a Medicaid-only program. Another question that we get often is, I haven't gotten my letter yet. So as I mentioned earlier, letters for Pathways went out between February the 19th and March the 22nd. If you've not received your letter and you're 60 years of age and older and have Medicaid based on age, blindness, or disability, we would like you to reach out to the Division of Family Resources to make sure that your address and your phone number are correct. Their system links over to our Pathway system, in order for those letters to be generated. And when you call the Pathways number, they want to make sure that your address is correct. So calling the Division of Family Resources and updating your address and your phone number is necessary if you've moved in the last couple of years and you've not yet received your notice. However, you can call the Pathways number at any time before April the 30th to select your plan. Do I have to be in the Pathways program is another frequently asked question. Enrollment in the Pathways program is automatic for those who meet the Medicaid eligibility requirements and are 60 years of age and older. However, if you are a member of a recognized tribe or you currently receive hospice services, you will have the option to opt in to the program, and your letter would have explained that. Will my Medicare benefits change? Medicaid benefits. Sorry, I misspoke. Will my Medicaid benefits change? No, your Medicaid benefits will continue as the same as they are today. So come July, it'll be the same Medicaid benefits that you currently have. It's just a difference is the Pathways program moving forward will be through Anthem, Humana, and United. Are there co-payments in Pathways? No, you will not have co-payments with the Pathways program. However, you may have co-payments as a part of a Medicare program. So if you currently have co-payments with your Medicare program, those co-payments would continue. However, for Medicaid, there are not co-payments. Another question is, what if my current provider does not work with my Pathways health plan that I'm selecting? We at the state are working diligently to ensure that members will still be able to see their current providers regardless of which MCE they choose. All 3 MCEs are currently working to contract with providers, so their directories may not be up to date at this time. Another question is, if I have Anthem, Humana, or United as my Medicare Advantage, do I need to make a selection? If you are happy with your Anthem, Humana, or United plan, the state will auto-enroll you with that same plan for Pathways for Aging. So if you currently have a Medicare Advantage with Anthem, Humana, or United, the state will automatically enroll you in that same plan if you're happy with that. However, if you'd like to choose a different plan, you're able to do so. Again, this program is not for Medicare benefits. It's a Medicaid-only program. Again, plan selection needs to be made by April the 30th. So we encourage folks to call the Pathways for Aging number. If we could go back to that slide, I think it's number 14. So we can see that slide again. Thank you. The phone number to call to select your MCE is 877-284-9294. And we encourage folks to call before April the 30th to make their selection. Again, if you've not received your letter, we encourage you to call the Division of Family Resources just to ensure that your address and phone number have been updated. If your address and phone number needed to be updated, you'll want to wait a day or two to call the Pathways number after that's completed to make sure that sync is done. Again, we hope folks make their choice. The state wants you to have the best coverage possible, and going forward, the Pathways for Aging program is that program. So we thank you for your time. We appreciate you listening, and we look forward to the Pathways program going live in July. Thank you so much.